Hello, everyone. My name is Sarah Rainbird. I'm the Head of Philanthropy at the Centre for Eye Research Australia, also commonly known as CERA. And I'm very excited to welcome you all this evening to our online community forum on healthy young eyes. I would like to begin by acknowledging the Wurundjeri and Bunurong people of the Kulin Nation, the traditional owners of the land on which CERA is, and also the Arakwal people of the Bundjalung Nation, the traditional owners of the land on which I am currently located. And I pay my respects to their elders, past, present, and emerging, and to their families. So, some general housekeeping before we begin. We encourage you to ask questions. We really would love this to be interactive. And we thank everyone who's already sent through questions for us. And we'll get to those later on in the presentation. You can ask questions throughout the presentation by typing in the question box that you'll see at the bottom of your screen if you're watching via the link, or the comment box if you're watching via Facebook. We'll try to get to as many questions as we can at the end of our presentations, but if we don't get to your question, we will endeavour to follow you up offline. So please be mindful that we cannot provide medical or management advice during the session, and we encourage you to consult your ophthalmologist or eye health practitioner if you have any concerns whatsoever. So I thought I'd begin by giving you an overview as to who CERA is and what we do. We have a few new people to the Centre for Eye Research Australia joining us this evening, so I thought it'd be good to just give you a bit of a recap on our mission and objective as an organisation. As I'm sure you would agree, vision is arguably the most important of the five senses. It is integral to our daily lives, playing a key role in the mediation of learning, perception and cognition. If we lose our ability to see clearly, we lose our ability to fully understand and interpret non-verbal cues such as gestures and facial expressions, so often communicated through face-to-face interpersonal communications. So at CERA, our mission is to eliminate the major eye diseases that cause vision loss and blindness and reduce their impact on people's lives. We have strong collaborations with the Royal Victorian Eye and Ear Hospital, as well as the University of Melbourne. And these enable us to create a strong innovative culture where we can actively support the commercialisation of promising research findings to accelerate the translation of new treatments and technologies from the laboratory to the bedside. I mean, really, ultimately, we want to get our new treatments to the patients, people experiencing vision loss. So healthy young eyes, why are we here this evening? Well, we've come together to provide you with information about your child's eyes and what you need to be aware of and look out for. As many as 1 in 5 children may have undetected vision or eye problems. And you know, as I've already mentioned, vision is one of the most precious senses, and it's a sense most used by babies and young people to learn about the world. As a parent, you will spend many hours looking at your baby's eyes and taking lots of photographs, and what you notice can be very important. I can personally relate to this as I have a son with strabismus that we'll be hearing more about tonight. And that presented as a turn in each of his eyes when he was, I think he was only 6 months old at the time. He's now 14 years old. So this was quite some time ago that I was endeavouring to find out information about his condition, and I must admit I struggled at the time. And so CERA, you know, at CERA, obviously we do research, but we also aim to provide information on the latest research on various eye diseases, and also help you find where you can go for further assistance if you feel something isn't right with your child's eyes. So tonight I'm joined by Research Fellow and Clinical Orthoptist, Dr. Sandra Staffiati, and Senior Research Fellow and Optometrist, Dr. Shoshana Saabji-Jadab, who will discuss, both Shoshana and Sandra will discuss the importance of eye health, some common eye concerns, and how to recognise early signs of eye problems in babies and young people. So firstly, I'd like to introduce you to Shoshana. I'd like to welcome Shoshana. Shoshana, as I mentioned, is an optometrist and a clinical research fellow with a special interest in keratoconus, corneal disease, vision restoration, and assessment of visual performance. Shoshana was part of a cohort who established the Keratoconus International Consortium, commonly known as KIC, KIC is a global approach entailing a large-scale international collaboration to enhance the understanding of keratoconus, a corneal condition that can cause teenagers and young adults to go blind. Shoshana also holds a co-appointment at the Department of Surgery at the University of Melbourne, where she's working on a prestigious NHMRC-funded research program that focuses on artificial intelligence and novel technology to detect and monitor corneal disease. Tonight, Shoshana will talk about general eye health, along with some common conditions seen in children. Over to you, Shoshana.
Thanks for that intro, Sarah. Good evening, everyone, and thank you for joining us in today's seminar. It's a pity that we are not able to do this as an in-person event, but particularly for this forum, when most of the parents are tuning in, I think the digital platform works well. Let me start by asking you all a question as to when was the last time you or your child got your eyes tested? If you're still thinking, then probably you're due for one. And I anticipate by the end of this session, you would all know how frequently to get your eyes tested and the importance of eye health. I'll begin my talk by briefly describing the structures of the eye and their functions. As Sarah mentioned, eyes are important photosensitive organs that allow us to see and interpret the shapes, colors, and dimensions of the objects in the world by processing the light and passing on this information onto the brain. The front part of the eye includes the eyelashes, which protect the eye from filtering out the foreign material, and so do the upper and lower eyelids. The eyelids also protect the eye from the bright light that might damage the eye, and also lubricates the eye surface by distributing the tears over the front surface. Next is the iris, which is the colored part of the eye. Cornea, the clear dome over the iris. Pupil, the black circular opening in the iris that lets the light in. And sclera, the white part of the eye. Then is the conjunctiva, which is a thin mucous layer that lines the inner surfaces of the eyelids and covers the front surface of the eyeball except the cornea. It keeps bacteria and foreign material from getting behind the eye. Now, this is the figure that shows the internal structures of the eye. And here, I've listed the functions of each of these structures. But to keep it simple, the eye is often compared to a camera. So let me explain about these structures of the eye by bringing out the similarities to a camera. The shutter in the camera is compared to the iris in the human eye, which controls the amount of light that's entering the eye. The lens in the camera is similar to the cornea and the lens in the human eye, which are both used to focus the light and create an image. With the camera, the image is recorded onto the film. In the human eye, the image is displayed onto the back of the eye, which is the retina. However, the camera stores the image one at a time, whereas the retina is constantly passing this information along the optic nerve to the brain. So, if I were to depict what I just said using the eye model, light rays coming from an object enter through the pupil, the curved surfaces of the cornea and the lens bend the light rays as they pass through them to form a sharp image on the retina, which is the back portion of the eye. The image thus formed is conveyed to the brain by the optic nerve in the form of electrical signals, which are then seen by the brain, as visual image. Now, with this common knowledge on the eye, let's move on to the children's vision. Vision is crucial to the child's development. It helps them play, learn, socialize, and explore their world. Approximately 75% of the learning comes through their eyes. A baby's vision goes through many changes in their first year of life. At birth, an infant is very sensitive to bright light. You may notice how small their pupils look, limiting how much light enters their eyes. At about 1 month, the baby may briefly look at the faces, but they still prefer brightly colored objects. From 2 to 4 months, the baby focuses and tracks moving objects. And from 9 to 12 months, they are on the go, gripping and grasping on things. Sharp, or the so-called 20/20 vision, continues to develop up to the age of 7 to 10 years. Eye problems in children can sometimes be obvious and other times very subtle. It is important to detect and treat these early while vision is still developing to avoid permanent vision loss in children. So I'll present to you some of the common eye conditions that affect the children. First one being refractive errors. Refractive errors are the vision problems that occur when light cannot focus onto the retina of the eye. This is caused by the change in the shape of the eye. Refractive errors include myopia, commonly known as short-sightedness, hyperopia, long-sightedness, and astigmatism. Nearsightedness or myopia occurs when the light entering the eye focuses in front of the retina instead of directly on it. Nearsighted people typically see up well close, but have difficulty seeing further away. Myopia is the most common refractive error among children and young adults. The prevalence of myopia has been increasing rapidly over the past few decades, and it's predicted that by the year 2050, half of the world population will be short-sighted. Farsightedness or hyperopia, on the other hand, is opposite to myopia, where close-up objects are blurry to the child, such as reading, and the distant objects are seen more clearly. Most children are moderately to mildly farsighted. Astigmatism causes images to be focused at different points on the retina. As a result, near and far vision are blurry. It's almost like looking into a fun house mirror in which you appear to be too small, too wide, or too thin. A simple way to treat these refractive errors is with prescription glasses and contact lenses or with laser surgery in adulthood. Now, the exact cause of the worldwide increase in the short-sightedness or myopia is unknown, but both genetics and environmental risk factors have been reported to play a role. A recent study conducted by one of the leading researchers at CERA suggests that 40 minutes of extra outdoor activity lowered the risk of getting myopia or more severe myopia. The kids who spend more time indoors in reading and in screen time were likely to get more severe myopia or get myopia. While there is no direct link, the study supports the idea of balancing the outdoor time with indoor time being beneficial for the child's health and well-being. This raises the question of what safe amounts of screen time is for children. There are many reasons for parents to be thoughtful about how much time or screen time they allow for their children. Amount of screen use per day has been associated with developmental outcomes, poor sleep quality, obesity, and eye development. Researchers have reported that preschoolers who had more than 2 hours of screen time per day had nearly 8-fold increase in ADHD. So the World Health Organization's guidelines suggest no screen time at all for children below the age of 1 year, and very limited screen time for several years after that. I'm sure the children watching this will be very surprised to know this. However, in today's world, mainly with homeschooling, I guess we cannot completely avoid screen time. So the best way to deal with this possible effect of screens on children's eye and vision is to help them set good habits for use. These same tips and good practices can be used by adults as well, or anyone suffering with chronic dryness or digital eye strain, as we call it. The first one being follow the 20-20-20 rule. This means to look up to your screen, to look up from the screen or the close-up work every 20 minutes and focus at least 20 feet away for 20 seconds. This strategy of frequent refocusing is called 20-20-20 rule and lets the eyes relax and reset. Next is to avoid using screens outdoors or in brightly lit areas where the glare on the screen can create strain to the eyes. Adjust the brightness and contrast of the screens so that it feels comfortable. Use a good posture when using the screen. Poor posture can contribute to muscle tightness and headaches associated with the eye strain. And finally, remind the kids and yourself to blink often when watching a screen. Moving on to the next condition, which is a common condition that affects children, teenagers, and young adults, is keratoconus. Keratoconus is a condition that affects the cornea, where the normal spherical cornea becomes thin and changes its shapes and affects vision. Keratoconus is a bilateral and progressive condition in most cases, meaning it affects both the eyes, and the presenting signs and symptoms worsen over the time. The symptoms include blurred and double vision, glare, distortion, and poor night vision. As you could see in this video, the condition worsens as the cornea steepens and thins as it moves from a normal to the advanced stage. Rates of keratoconus have been drastically increasing from 1 in 2000 in 1986 to 1 in 375 in 2016. That's amounting to 5-fold increase over the past 2 decades. Pediatric keratoconus, that is keratoconus which affects children, appears to be more rapidly progressive, and higher rates of treatment failure have been reported compared to adult keratoconus. Also, keratoconus is the top indication, one of the top indications for corneal transplantation globally, that is replacing the deceased cornea with a cadaveric donor tissue. And in Australia, it accounts for almost 30% of corneal grafts. Management: in the early stages, vision is corrected to a large extent with glasses, but with the progression of the condition, the vision with glasses deteriorates and rigid contact lenses are required. In few patients, as I mentioned before, the central cornea becomes extremely thin and severe, and corneal transplantation is required to restore vision. Few other forms of surgical techniques include intracorneal ring segments and lamellar keratoplasty, but all these techniques correct the refractive error and do not treat the underlying cause that causes the corneal weakness and thinning, and therefore cannot stop the progression of the condition. Collagen crosslinking is the new treatment option for keratoconus, wherein the cornea is stiffened by the application of riboflavin drops and exposure to ultraviolet rays. Although it has been shown to slow the progression of keratoconus, it can only be applied in the early conditions. Now, despite the increasing prevalence of the condition, there are still many unanswered questions related to this condition. So we established the Australian study of keratoconus with the main aim of identifying the risk factors for the condition, early detection of keratoconus and its management, and also, as Sarah mentioned, using artificial intelligence to improve the current diagnostic management strategies for keratoconus. Keratoconus International Consortium, which is an international collaboration, is an extension of ASC, where we have the global collaborators involved to understand the condition and to avoid the need for corneal transplantation. If any of you are interested to know more about this condition, please join us for the keratoconus information session in November. And if you would like to volunteer for this study, please contact me. Now, the other eye problems that are commonly seen in children include conjunctivitis, also known as pink eye, which is the eye infection commonly seen in toddlers and children going to school, where there is an inflammation of the conjunctiva or the swelling of the conjunctiva. Pink eye or conjunctivitis can be viral or bacterial, which is contagious and or infectious, or allergic, which is non-contagious. A child's eye may be red, itchy, teary, and have a slight discharge. Keep your child home from school if they have a contagious pink eye. The pink eye usually goes away on its own within a week's time, and sometimes antibiotic drops are required. A stye is a red sore lump at the edge of the eyelid. It is caused by a bacterial infection. Warm compressions using a clean, warm cloth is used to treat the infected area, with an antibiotics required in some cases again. A chalazion looks similar to a stye, which is a swollen lump on the eyelid, but this is caused due to the clogging of the oil glands. Again, warm compressions and would treat the chalazion. The last one in the picture here is a nasolacrimal duct obstruction, also called as the blocked tear duct, which is seen mostly in the newborns, where the tears don't normally drain and causes watery, irritated, or infected eyes. A special massaging technique is used to open the tear duct and usually resolves in most of the children. And if the massage doesn't help, an ophthalmologist may try to use an instrument to open the duct. Now, these are only few of the most common eye conditions that I mentioned, but there are other symptoms to watch out in your children, which include trouble seeing the blackboard, difficulty reading, jerky eye movements, squinting, tilting head, or covering one eye to read, about which Sandra would be covering in her talk next, or frequent blinking, oversensitivity to light, sitting very close to the TV, seeing double vision or poor concentration. Please watch out for these conditions and seek advice from medical health professional when required. Now, the question is, when should I get my eyes tested? There are different opinions about this, but what is usually recommended is to first have the eyes tested at least at 6 months age to screen out for any abnormality or if you have any concerns. Then they should have a comprehensive eye test at the age of 3 years, followed by 5 to 6 years when they are just about to start school. School-aged children should have an eye test at least every 2 years if they have no vision correction. And children who need glasses or contact lenses should be examined annually or as recommended by your eye practitioner. Lastly, here are some recommendations that would help protect your children's vision. Cover the pram to protect your baby's fragile eyes from sun. Ensure your child wears a brimmed hat outdoors to help protect the eyes from the sun's ultraviolet rays. And combine the brimmed hat with the sunglasses to reduce the exposure of the sun to the ultraviolet rays. Choose the sunglasses that meet the Australian standards and have 100% ultraviolet protection. And finally, serve your child with a balanced diet. Finally, I would like to conclude my talk by saying that even if you're not sure whether there is a problem or not in your child's vision, have your concerns checked out. It's better that your child's eyes are normal and healthy than a problem being left undiagnosed. Untreated problems can lead to serious and permanent vision loss in children. Thank you. We are going to publish this information and a bit more about healthy young eyes in the upcoming newsletter, which will be on our website pretty soon. So do watch out for that. Thanks.
Thanks, Shujana. That was a fabulous talk, and I'm sure, I hope that all of you found it very useful, particularly the tips around screen time with children. With a lot of Australia in lockdown at the moment and homeschooling, I can imagine that was very useful. You also triggered a question in me, Shujana, which hopefully I'll get a chance to ask later on. I was diagnosed with myopia in kindergarten, and I'm wondering, how strong the genetic component is in determining myopia, but perhaps we'll get to that. We might have time to get to that at the end. Now I'd like to introduce you to Sandra. Sandra is a research fellow at CERA and the retinoblastoma care coordinator, senior clinical orthoptist at the Royal Children's Hospital in Victoria. Her research focus includes hereditary eye diseases, including congenital glaucoma, congenital cataract, eye movement disorders, and retinoblastoma. Sandra also recently completed her PhD with the aim of reducing delayed diagnosis of retinoblastoma, which is eye cancer in children. The outcomes of her doctoral research studies have been incorporated into the infant health book provided to each parent and entitled My Health, Learning and Development, as well as the Maternal Child Health app in Victoria. Tonight, Sandra will talk to you about strabismus and leukocoria. Over to you, Sandra.
Thanks very much, Sarah, and I'd like to thank the audience for logging on this evening. I guess you're right, we don't have much better to do on an evening like this since we're all in lockdown, and I'm excited that this is the first time that CERA is focusing on children's vision. So even though for me personally it was a few decades ago now that I was a new parent, being a new parent is as exciting as it can be, absolutely overwhelming. And health professionals, by and large, will guide and provide important information to help you as a parent to keep your baby healthy and safe. But there is so much information that can be accessed now. We've got social media, we've got print news, and of course, we've got our good old friend Googling the internet. In the next 15 minutes, I'd like to talk to you about two specific eye problems that are often considered nothing, but actually might be something, and what you would need to do. There really is just too much to remember. So I like to encourage parents to just know and remember what normal looks like, so that anything outside of that would prompt you to seek advice from a healthcare provider, whether it's your GP, your health nurse, an optometrist, or a paediatrician. Now, vision develops from the moment a baby is born, not just how clear the vision is, but learning how to use their two eyes together. From birth, in the brief periods that the baby's actually awake in those first 4 weeks and they're not hungry and they're not crying, they will react to bright light and be attracted to faces. From about 1 month of age, they will start following objects and smiling because they see you smiling at them. By 4 months of age, their eyes should be moving together all the time. Their clarity of vision continues to improve from seeing an object and swiping at objects to actually picking them up. As you can see, this baby in the bottom right-hand corner, just picking up small things like particles of dust or hundreds and thousands, which is what that baby's doing. And vision stops developing, or a child reaches visual maturity around about 7 or 8 years of age, which Srijana covered quite nicely. Now, at various points during a child's development, their eyes will be examined, and sometimes you might not even realise that it's actually happening. The first time is while they're still in hospital or at the 6-week well baby check. The doctor or midwife will just examine the eyes in general sense and make sure that they appear normal in shape and appearance, and they will do what's called the Red Reflex Test. Now, you will all be familiar with the red eyes that we see in photos taken with a flash, and we go to great lengths to get rid of them. But this is because light entering the eye unobstructed bounces off the blood vessel layer at the back of the eye. Now, we use this phenomenon, as terrible as everybody else thinks it is, we use this phenomenon to actually detect eye problems too. By shining a bright light into a baby's eyes, we can examine how this light is reflected back from the inside of the eye. It's painless and it's a non-invasive test. When we do the Red Reflex Test, we are checking that there is no sign of actually a cataract. Yes, babies can get cataracts too, not just old people, or any other problem that might be inside the eye at birth. Diagnosing cataracts in babies early is very, very important, and that's because cataracts in babies is nothing like cataracts in old people, because the baby's eyes are still developing and they can have a dramatic impact on their vision development if they're not diagnosed and treated early. Then when you visit the health nurse for those regular checks, they may ask you from time to time about any concerns you might have. And that's been a lot of the focus of my research work. And they'll check that your baby can look at something and follow it. And that will happen in the very early couple of months. Then there's a big hiatus where you're left to notice eye problems. And then at 3.5 or 4 years of age, at that particular health check that the health nurse does, if you take them, they will ask you about any concerns you might have, and they will check to see that baby can look at something. They'll also test their vision, and you'd be surprised how well children that age can actually do a vision test. It's important that children have this screening. At the moment, it's only about 63% of the Victorian children actually present for this test. But when I work clinically, we see many children whose problems are being picked up at this screening check that parents were completely unaware of simply because the child behaved as if they could see properly. That is, they'll still pick up dust off the floor and they'll still point to aeroplanes in the sky, just the same as if they had good vision in both eyes. Vision has to be fairly poor before a child behaves like they can't see. And that's because they don't know they're supposed to see any better. And they're not really looking at very small things. They're not having to read road signs or anything like that. And our TV screens are enormous, so the images on the screens are enormous too. Now, across different states of Australia, different screening examinations by the health nurse might occur in between times, but by and large, it will be up to you as parents to notice there is something wrong and see an appropriate healthcare provider about it. So what you notice can be very important, since looking after our eyes starts at birth and not at 40. Not all eye problems will be present at birth. They develop during early childhood or throughout childhood, as Srijana demonstrated. So tonight, I'm going to talk about the two most important signs of an eye problem that need to be checked out by a professional. For children, early detection is absolutely critical to making sure their vision develops optimally. As a clinician, I know these signs are often overlooked for a lot longer than they should be, simply because people don't know that these signs can also mean a very serious problem. So let's talk about white pupils, and they can be referred to as a glint or a glow, a flash, or like a cat's eye. You'll be familiar with white pupils that we see in animals, and that's where we actually get the term cat's eye reflex, when a cat runs across a road and they catch your headlights and you get that white, the white of their eyes. They get the white pupil because they've got a special extra layer in their eye so that they can see in the dark. We don't have that sort of layer in humans, but we also get white pupils with some smartphones, or if the child is looking at just the right angle and the flash bounces off the optic nerve and not the blood vessel layer. But white pupils can actually be a sign of a significant problem. Firstly, any white pupil you can see with the naked eye is almost always a sign of something serious. Almost all parents would recognise that the usually black pupil shouldn't appear white, and it is likely significant, and you should see a doctor properly. White pupils only seen in a photo are a little bit trickier. That's because something can look exactly the same as nothing, even when it may not appear in every photograph, which often reassures some parents to think that it's nothing. If you have taken a photo and can see a white pupil, first of all, don't panic. It is most likely nothing, but it's only nothing until it's been proven that it's not something. The only reliable way to tell, though, is by an examination by someone who is used to examining children's eyes or knows how to do the red reflex. And GPs are well trained in doing this, as are optometrists. If we return to our diagram that I showed you before explaining why we get red pupils, this image shows you why we get a white pupil when there is a growth inside the eye. So you can see that there. Depending on where the child is looking, in some directions, they may get the red eye that you would expect, and in others, it will be all white. So pupils you can see that are white with the naked eye, as in the baby on the left-hand side of the screen, are almost always a sign of something serious, and you should see someone promptly. white pupils seen only in a photo, retake your photos with red eye reduction switched off, and take the photos from a few different angles. There are some apps in circulation that you can use to scan your photos on your phone, but I would like to caution the use of these or relying on these apps totally as a medical opinion, as they are still in the validation stages of development. But this is a very promising way forward to use technology that might actually help us detect children's eye problems sooner. Now we're going to talk about turned eyes. And there are lots of different words that we use to describe turned eyes. It might be called a squint, crossed eye, a lazy eye, or strabismus. And it's easy to see why we have this idea that a baby or a child will grow out of an eye turn, because in some cases they actually do. I already talked about briefly how babies' eyes appear to turn for very brief times or brief periods until about 4 months of age, when their brain learns to use their two eyes together. But the other reason they appear to grow out of a turned eye is because the wide folds of skin that form the bridge of the nose can often give the impression the baby's eye is turning inwards. As they grow, that wide nose narrows and the appearance of the eye turn disappears. The way to check this is just to shine a light from about 35 centimetres away and look at where the light falls. If the light falls in the same spot in each eye, the eyes are actually straight. But if you're worried and you're not sure, go and see your doctor. As with pupils, the white pupils, something can look exactly the same as nothing. Most turned eyes, and the majority of true eye turns, though, are a condition in their own right. Most turned eyes are quite benign. We know that they run through families. We know that it occurs in children who are overly long-sighted or have a history of prematurity or other significant health problems. It can be a very common condition and is the most common cause of avoidable vision loss or amblyopia. When the eyes are not straight, so not pointing in the same direction, this interferes with the development of the child's vision, so they develop amblyopia, as well as their 3D vision. That's why diagnosing and treating all eye turns early is really important to minimise the impact that it has on long-term on children's vision development. In fact, CERA researchers identified amblyopia as being the leading cause of reversible vision loss in one eye in Australian, non-Indigenous Australians. So that's a really good reason to diagnose and treat squints early. Now, not all eye turns require an operation. Sometimes it might be just wearing a pair of glasses might make the eyes straighter. Sometimes it's a combination of treatments. If a child needs to wear an eye patch, that's to treat the vision loss that's occurred because of the eye turn, not to correct the eye turn itself. But more importantly, sometimes the squint might actually not be the problem, but rather a sign of something much more serious. That is, there's something inside the eye that is affecting the vision so much in that eye that the brain can't use the two eyes together, and one of the eye turns. The eye can wander in any direction. It can go in, out, up or down. It can be of any size, and it might not even be there all the time to start with. Again, a squint can be caused by something serious, looks exactly the same as nothing serious. And the only way to tell is to actually have a formal eye examination by someone who is used to seeing children. So there you have it. That was probably a lot of very overwhelming information, and I hope I haven't panicked you at all, because that was not my intention. But you can read more about all this information in the Keeping Young Eyes Healthy Guide, which will be available soon. Or you can visit the CERA webpage for more information to access a copy of the information pamphlet that I developed for parents, but with parents, during my PhD study. Thank you.
Thank you, Sandra. That was a fantastic presentation, and I'm still learning a lot about my son's condition, strabismus, and thank you. I learned a lot in that session as well. So now we've only got 5 minutes left, so we're going to jump straight to question time, if that's okay. We've had some questions come through in advance of today's session, so I'll address those first, and then we've got a couple of questions that we'll go to from today's questions that have come through while we've been in the session. The first one, I think, probably is best for Sandra to ask, because it's from Tess, and Tess has said, my son is 2 years and 2 months and has to have corrective eye surgery. She hasn't specified what that is for, but I suspect maybe strabismus. I'm so worried. Is it true it'll affect his vision if he doesn't have it by 2.5? Sandra.
Oh, that's an interesting question, and it's hard to give a very short answer. Obviously, one can't give any medical advice, but sometimes the timing of surgery can be critical. But really, surgery to straighten the eyes to achieve the ability to use the two eyes together probably needs to be done by about 1 to 2 years at the absolute latest, but usually under 1. The biggest issue with an age limit is really improving the vision or fixing amblyopia that is caused by the strabismus. And that's sort of 7, 8, sometimes 9. So we need to address the vision by 7 or 8 years of age. The surgery is not going to fix the vision at all. Amblyopia, the eye patching that's used to treat amblyopia is where we need to focus our attention.
Thanks, Sandra. And while I've got you, you might be able to answer this one too from Lucy. Lucy has asked, has said that her father has glaucoma, was diagnosed with glaucoma at a young age. What are the signs to look out for with her children?
Yeah, so glaucoma in children's or glaucoma in a young age is a little bit like cataracts is a little bit different in children than it is in adults. The most common type of adult glaucoma is called primary open-angle glaucoma, and you don't really know you've got it until you have your eyes tested routinely at the local optom when you go along for your reading glasses, and they're always looking for that. Whereas in a child, there will be some rather impressive, for want of a better word, symptoms or signs. Baby will be light sensitive. The front of the eye, the cornea, might look cloudy. They might even just have a watery eye. So as Srijana mentioned, watery eyes in children, most often, again, it's nothing, but sometimes it will be something. I think given there's a family history, as I mentioned before, we know eye problems run through families. If you're worried, get someone to examine your kids. But I would imagine that if they were going to have glaucoma now, that you would know that by now. But I don't know how old the children are.
Thanks, Sandra. And the next question comes from Anne, and maybe Srijana, you could answer this one. Anne has asked, what is the expected refractive error for kids at different ages?
That's an interesting question. And as I covered part of it in terms of the growth of the eye, most of the children are usually hyperopic or long-sighted till the age of 7 years, when the eye is trying to emetropize, as we call it, or normalize and develop the sharp vision, which happens after the age of 7 years. Again, based on the genetic factors and the environmental factors, such as near work or computer usage, myopia tends to develop after that age. So mostly it's hyperopia before the age of 6 years, and beyond that, it will be myopic.
Okay, well, thank you. That leads me to be a bit sneaky and add in my question. You've both mentioned that most eye diseases, there is a genetic component, but I was diagnosed with myopia in kindergarten, which I would have been 4 or 5 at the time, and both of my parents have 20/20 vision, and so it is possible. If both parents have really good eyesight, it's still good for them to be aware that, notwithstanding the fact that they both have really good eyesight, that there can still be issues with their children's vision.
Definitely. As with most of the eye conditions, many of them are genetic, and they do have an environmental factor as well. So it's difficult nowadays to tease out whether it's just genetic or the environmental factors that are causing a certain condition, like in your case, or with the keratoconus, as we say, eye rubbing causes keratoconus, for example, whereas some patients may have a genetic predisposition. So it's a combination, I would say, for most of the ocular conditions that causes it, or it may just be one particular risk factor that kind of causes the condition. So even if you didn't have parents who had a particular condition, the children may develop it, as in the case of myopia, prolonged near work, not being exposed to outdoor activities could be the cause of increased myopia in children nowadays.
Okay, great. Thanks, Shoshana. And we've just got a couple of questions. We're almost out of time, or we are out of time, but I'll quickly ask two more questions. The first one is from Marin. Does oxidative stress cause damage to children's eyes? If yes, would reducing oxidative stress through diet, wearing sunglasses, etc., protect the eyes? And I don't mind who answers that.
You want to take that, Shoshana?
Right. It is a quite interesting and complicated question, I would say, because what actually do you mean by oxidative stress? Because it depends, I think, on a particular condition. There are a few conditions, if you're talking about corneal degenerations, for example, they are related to the oxidative stress. There are some studies which have reported to be associated with the corneal degenerations or corneal conditions, but it really depends on what oxidative stress you are kind of mentioning about. Overall, wearing sunglasses and protective hats protects your eyes from various eye conditions, is what I would like to say, unless Sandra wants to add anything more.
Yeah, no, I totally agree. I think, you know, a good hat, wide-brimmed hat, takes us a long way in terms of being sun smart, but it's also eye smart. So I think that was, I've got nothing further to add other than that, really.
Great. Thanks, Shoshana. Thanks, Sandra. One last quick question, and hopefully it's a short answer, from Nita. Nita, thank you for your question, if you're still on the call. Can astigmatism cause an increase in conjunctivitis?
Astigmatism and conjunctivitis are two different entities by themselves. Astigmatism is related to the shape or structure of the eye, whereas conjunctivitis is an infection which is caused by a viral, bacterial, or an allergic factor, which is more related to the conjunctiva. So both of them are totally unrelated. Astigmatism can be related to keratoconus, but not conjunctivitis.
Great. Thanks, Shoshana. So that was the last question for today, for what's been a fantastic online forum. If we didn't get to your question, we will endeavour to get back to you offline. But can you join me in a virtual round of applause for Shoshana and Sandra and their talks this evening? This evening's forum has been recorded, so you will be able to, we will be able to email you a link in the coming days if there's some information you'd like to listen to again. We'd also love to share with you the Healthy Young Eyes information booklet, which we've mentioned